Hello, this is Shamak Acharya, and this is my internship report on the Madison County Health Department. The Madison County Health Department provides services for adults, children, and health professionals. And a few services that they provide for adults include diabetes education, physical activity guides, and services about HIV and AIDS. And they also provide services for children such as dental services in schools, health information about certain diseases such as the flu, and immunization services. They also provide budget systems for people who cannot afford to pay for food. They also provide statistical and helpful references for health professionals to use in their research. And they also provide information about their health assessment plans. And these are all the services that the Madison County Health Department provides as in their website, as shown here. There are a few major responsibilities that I had to do as a public health project assistant. And one of these is gathering information about what the social determinants of health are and putting those into context in the case of Madison County, and organizing those data and interpreting what they mean as I compare those data about Madison County with the state of Kentucky and the United States to see how well the Madison County fares with those two and all those indicators listed in the social determinants of health. And my activities also ties in with the bigger goal of the Madison County Health Department of trying to keep people healthy and safe. And one of the other ways they go about gathering those primary data is through surveys. And after they gather all those different types of data and interpret what they mean, then they will come up with different solutions as part of their community health improvement plan, which they will do every 5 years. And one of the possible outcomes of this is improving the walkabilities of neighborhoods. And during my internship, I have achieved my competencies in the Madison County Health Department, and one of these is demonstrating communication skills by explaining what the Excel data and graphs mean, such as with the number of college graduates between the United States, state of Kentucky, and Madison County in a PowerPoint presentation. And I also demonstrated assessment of needs, assets, and capacity to see how Madison County residents fare well when they compare to the rest of the state of Kentucky and the national level. And one of these examples include the average household income for Madison County residents as compared to the state of Kentucky and the rest of the United States. And I also gathered data about different conditions of Madison County from different types of sources, such as from the United States Census and Kentucky Health Facts. And these examples include demographics and how many people have disabilities or not, and also provided helpful recommendations based on the data that I had collected from those sources that I just mentioned previously. And that is it when it comes to the walkability of neighborhoods, as I had done from my research. My coursework has helped me to be prepared for my internship in a few ways. I learned how to summarize reports based on the data that I had collected about my topic, in this case about the social determinants of health of Madison County. And one example from my coursework that actually helped me was the data analysis homework from my risk assessment and environmental epidemiology course. And I also learned to build up my confidence of creating and giving a professional presentation, as I've been giving presentations from all of my other courses, and one in particular that is interesting and that was helpful to build up my confidence was my presentation about epilepsy and how it differs from seizures. And I also learned how to differentiate between different types of sources and how to choose credible ones. And the different types of sources here are primary, secondary, and tertiary. I also learned how to utilize different office products such as PowerPoint, Excel, and Word documents at, and at a higher level. And my class projects were the best practice for me to put what I've learned in lecture into practice. There were a few challenges that I had to deal with when I was doing my internship, and one was trying to deal with the issue of my internship being difficult, and it was really, and I had to deal with them in two ways. First one is getting mental support from my parents, classmates, advisors, and professors, in which things that I need to do my best at the to my ability, and do not have to worry about the results that I do, and in way to keep myself organized is by creating a schedule of what tasks that I need to do on a day-by-day basis. And an example is like working on the internship report until 2:15 p.m., which was a day in the past that I had set as an example as I was typing up this report. And there are a few professional skills that I have learned, and one of these is the first one being able to put my interpretation data into a different format, such as in a PowerPoint presentation, not just typing it up in a Word document. Second, I learned how to label graphs by utilizing the power of Excel. And I also learned how to communicate my data and my assignment progress to my group members in a group setting. When we met together for the Madison County Health Department group meeting. Learn how to make my time flexible to get certain things done during a certain time period, such as coming on days that I would not have to work, such as Fridays, to get some employment paperwork done, in which, since I'm already here, I can work on my task after I'm finished, since I have the whole day to myself. And I also learn how to manage my time to work within other people's schedules, such as getting ready by 7:15 to come to campus on time by getting ready within my dad's time limit of 7:15, so I can catch a ride to campus so I can start working on my assignments for the Madison County Health Department. To sum up, my competencies were further developed and improved upon during my internship, and one of these is I learned how to present my data that I had gathered and interpreted in summary in a different format, such as in a PowerPoint, not just typing it up in a Word document, and also further my skills of identifying different types of sources to locate information, to create, analyze, interpret those different characteristics of data from different types of data sources, such as from the United States Census, to gather information about, in the case of the social determinants of health of Madison County, and also provide recommendations based on what those same data that I had gathered, such as improving the walkability of neighborhoods for Madison County, as an example. My internship experience has influenced my career goals of wanting to still be in the path of becoming an epidemiologist, since I had put those skills into practice at a basic level during my internship. And as an epidemiologist, I can be part of a group team to come up with solutions to health issues by providing my expertise in data analysis and interpretation to my group members as a public health resource person on what tasks that we need to do to fix the problem, to improve the health of the public. There are a few recommendations that I have to improve the internship experience for people of EKU, especially students, is encouraging students to find and document their competencies as they go about doing their internship tasks. That way it'd be easier for them to document and fill out their internship reports, and also to give students the mental support they need during their difficult times of their internship. And these are all the different PowerPoint presentation links that I made reports on based on the data that I had done for the Madison County Health Department. These are the embedded presentations for those same links. And it's the same thing for behavioral health data of Madison County. And on the left is the Word document and PDF version of this internship report typed up in a Word document format. And these are all the references for the Madison County Health Department internship report that I had done. Thank you, and if you have any questions, feel free to leave me questions after the presentation is over. Thank you and have a good day.